Okay, so I think I'm supposed to go ahead and get started. So my name is Kramer, and I'm going to be talking about aging and the kidney. So I think what we could do, though, before we get started is just stand up, and we're going to do some anti-aging exercises, okay? So this is actually not for your muscles, but for your brain. So what you do is you want to stand up, and then you want to try to do something with your right side on your left side of your body. So you can take your right hand and pull your left ear, or pat yourself on the left shoulder. So this actually really stimulates your body. So you can take your left hand, grab your ear, pat yourself on your left shoulder. Okay, all right, now we're all stimulated and ready to talk about how we can stay young with aging in the kidney. So the kidney is actually extremely resilient to disease. And the fact that we have like 600,000 people in the US with kidney failure says a lot about our society and our health and our lifestyle. Because normally really the kidney shouldn't have a lot of injury because of the way it's designed. So remember that the working unit of the kidney is what's called the nephron. So the nephron, I have this little picture right there, right? We have two kidneys, but each of those kidneys hold these nephrons. And the nephron is actually the working unit of the kidney, and it filters the blood. And then it has all these pipes that basically take the filtering, take all the garbage away and then dump it into the Chicago water system if you live close by, right? So that's what the kidney does. So we actually have, in healthy state, you have a lot of them. You have actually almost 1 million of these nephrons in each one of your kidneys on average. Now, if you were born with a low birth weight, or maybe you've had injuries as a child, if you were severely ill as a child and hospitalized, you could have lost some nephrons then, or then as an adult, if you used a lot of medications that could damage your kidney, or if you developed a disease, if you developed diabetes, that could have then led to loss of nephrons. But then you also just lose nephrons as we age, which is another thing that we'll talk about. So the GFR, your kidney function, is really determined by all of your nephrons. So the total glomerular filtration rate, or kidney function, is actually just the sum of the function of each one of your nephrons. So you can actually donate a kidney in a healthy state, lose half of your nephrons, and your glomerular filtration rate doesn't even change, because you have so many nephrons that the remaining ones can just work a little harder. So in a healthy state, when you donate a kidney, their kidney function stays the exact same. So by the time you see decreased glomerular filtration rate, that means you've lost more than half of your nephrons for sure. And so that's the problem with kidney disease, is that we're really detecting it and treating it when the train has already left the station. So that's really an issue. Now, aging is important because aging does affect the kidneys. And so if you have kidney disease, you have to also account for the fact that as we age, we're going to lose kidney function as well. So the aging process, is really poorly understood. It's been researched for decades, and there are some things that we have determined over the past, especially past 10 years. But we really think it has to do with an interaction between a genetic background, your genetic code, and then the environmental factors and behavioral factors. So the genetics, you can't do anything about, right? I mean, you're born with that. There's nothing you can do. But we can change our environmental factors to some degree, and we definitely can change our behavior. So that's the reason why it varies so much, is because even looking at people who have the exact same genetic background, like twins, they actually will age differently. So there's a lot of things we still don't understand. So aging has to do with cell repair. So you have a huge amount of cells that are turned over every single day. And small numbers of those are actually kidney cells. Many of your kidney cells actually don't turn over, and they have to last a lifetime. And so that's one of the reasons why the kidneys are really susceptible to aging. So with aging, we lose skin elasticity, our bones become less dense, our muscles become, have less muscle mass. We're not able to run as far because our lung volumes get lower, and our heart becomes stiffer, and our blood vessels become stiffer as we age normally. And in the kidney, what happens is that you lose those nephrons. So remember, we talked about the nephrons are the working unit of the kidney, and those actually do decline. They actually die off. And then those decreased nephron number means we're going to be more sensitive to salt as we age, and our blood pressure will go up more with salt. So a younger person, they can eat a ton of salty popcorn and just get rid of that salt in a pretty quick fashion. And an older person, they actually blood pressure might go up with a high salt intake. So this is just showing you two kidneys. The one on the left is a normal, healthy young kidney, and the one on the right is a normal kidney with aging. Just showing you, if you look on the very outer rim of the kidney, that's where all those nephrons are, and that's called the cortex. So the cortex is what holds all of those nephrons. And you can actually see in an ultrasound as you go from age 40 to 60 to 80 that the cortex becomes thinner. And that is just because you're losing those nephrons normally with aging. And then what happens is, remember, each one of those nephrons filters the blood, and your total kidney function or glomerular filtration rate is really just the sum of the filtration of each one of those nephrons. So if you lose enough of those nephrons, then you'll actually see a decline in glomerular filtration rate. And so within each decade after age 50, you normally lose about 6 mils per minute of GFR per decade on average, or about half a mil on average, half to 1 mil per minute per year. We used to say after age 40, but now we're saying after age 50, so that's good, right? But you do lose kidney function with aging, regardless of whether you have a disease or some kind of genetic predisposition to kidney disease. So if you're battling a disease that is, you're trying to battle this disease that's fighting your kidney, you also have to think about that you just have aging on top of that as well. So if you look at people who are age 90, the majority of those people will actually have a glomerular filtration rate that's less than 60. So the average GFR for someone with a GFR of 90 is around 45 to 50. So, but that doesn't necessarily mean that's anything necessarily really bad. It's just normal physiologic aging. And so this is just looking at like, how could we actually calculate nephron number? Is we could actually do a kidney biopsy in someone, and then we could do a CT scan to look at how thick that edge of the kidney is. And then we could kind of estimate then, based on our kidney biopsy, how many nephrons a person has. And so there are studies that have looked at this and just showing that the number of nephrons over time declines with aging. And so this is the shaded area is looking at the percentage of the nephrons in a person's kidney, healthy person that is scarred and gone. And so you can see about after the age of 70, you're lost about 25% of the nephrons are scarred, just based on those particular studies. And there's a lot of error in that. Now, if you look at chronic kidney disease is actually pretty uncommon in young people. Of course, we know that there are about 10,000 children in the US that have kidney failure, but it is uncommon. So kidney disease, though, among people over the age of 60, based on glomerular filtration rate, is much more common. And we think about 15% of people over the age of 60 will have chronic kidney disease. And then this is just looking at data from a Japanese population showing that if you look at people who are over the age of 80, based on just a GFR less than 60, that, about 50% of the population will have a GFR less than 50. Does that mean that that's something really horrible? No, it's just physiologic aging. And so this is just showing the mean GFR by age group, showing you that at age 70 to 74, the mean GFR is around 67, and it declines all the way down to about 42 at age 90. Now this curve, what this is showing you is the association between glomerular filtration rate, your kidney function, and risk of mortality. And just showing you that the highest risk of mortality associated with GFR is among young people, because young people don't normally have reduced GFR. But older people, especially people over the age of 70, are much more likely to have a GFR less than 60. So the association between kidney function and mortality is much lower among older people, and it's much higher among younger people. That's something just to think about to make you feel better if you're older with low GFR. So some people actually suggest that we should change our classification system of kidney disease. So right now we say if your GFR is less than 60, then you have chronic kidney disease. But what they're saying is that if you are over 65, that you should really use a GFR less than 45 instead of less than 60. So this is just showing you kind of an age-adapted definition of chronic kidney disease. And remember, less than 60 is considered to be chronic kidney disease by our current classification system. If you think of if you've been told stage 1, stage 2, stage 3, stage 4, stage 5. So just showing you that if you kind of just look at normal physiologic aging, you can see that our current classification system does capture a few people in the older age group who don't really have kidney disease. They just have normal physiologic aging of the kidney where you have nephron loss, and that means your kidney function goes down. So this is just showing you the issue with the kidney. This is a kidney biopsy specimen. And what you see on the far left right there is what we call onion skinning of an artery. So do you see how it looks like there's a whole bunch of things going around and around and around that artery? So normally you should have a nice wide open artery, but this one you can see it has a whole bunch of scar tissue going around it. That's called arteriolosclerosis, and kind of think of an O going around and around and around, wrapping all the scar tissue around that artery. And that's a classic sign of long-standing hypertension and also aging of the kidney. And then the glomerulus that's on the right-hand side here, that's actually looks pretty good. You can see how there's these open capillary loops. I'll show you right here. Here is where the blood is going through. Those are just the open capillary loops, and the blood is filtering through there. So that looks healthy. What you would see, though, in a scar is that you wouldn't see any of these open capillary loops. It would just look like a whole bunch of pink material in the scar. So the arteriolosclerosis then actually can exacerbate loss of nephrons, because that artery, that arterial, has such a small opening. You don't get good blood flow. You can lead to more loss of nephrons because of loss of blood flow to those nephrons. So just again, showing you that with chronic kidney disease, that we have healthy aging. So if you're starting off with the low GFR because of diabetes or high blood pressure or some kind of genetic disease, then you're at an issue, because you're going to have further loss of kidney function with aging. So whenever I see someone who has kidney disease and they have decreased GFR, we have to think about, okay, they're starting out with a level of a GFR of, let's say, 40, and I know they have 20 more years of life to live. I know that they're going to lose this much kidney function with aging alone. And so I use that to think about when the person could end up needing a kidney transplant or dialysis. And so that's the reason why, if you have a family member or you yourself have kidney disease, to really try to self-manage the disease now and not delay that treatment and not delay that therapy, because time is your enemy. Because as you move forward with time, you are going to lose nephrons. So the time is now to get treatment and get activated and take care of yourself now. And don't let the clock start ticking against you. So let me just move forward. So we have about a 48% decrease in nephron number from age 20 to 75. So you're losing about 8,200 nephrons per year, or 23 nephrons per day. That's almost like 1 an hour. So you have to think about how time is just constantly ticking away. You have to start taking care of those kidneys today. Okay, so we said before we have age-specific guidelines, but right now that's probably not going to happen, and we are going to be sticking with the GFR less than 60. I think that's really going to be staying with us. So in conclusion, we have healthy, normal kidneys do age with the nephron scarring, and the nephrosclerosis, that nephron scarring, then leads to decreased GFR as we age. So as we said, the total GFR is the sum of all single nephrons. And what can we do to try to address that issue? So one thing is we can think about how in the US, we really eat too much. And it's been shown in animals that we can actually slow loss of kidney function and that scarring by doing what we call caloric restriction. And that's been shown in multiple animal models. So caloric restriction has been studied for aging itself. The National Institutes of Health actually put $100 million into doing a lot of this aging research in caloric restriction, but they found that it did not decrease mortality. The lifespan really didn't change in large monkeys. So the thought that if you eat a super small amount, you're going to live a lot longer is probably not true. But when it comes to the kidney, we do think that caloric restriction is beneficial. And that's, so it's been shown in many animal models. And this is just looking at, just to show you, this is 15 different studies, all showing that when you look at how it favors caloric restriction as far as protein being in the urine or scarring in the kidney, caloric restriction is beneficial. And the other thing is that caloric restriction has also been shown to benefit cyst production. So this is just a CT scan showing the cysts in the kidney. So I don't know if many of you have heard about polycystic kidney disease, or if you have someone in your family that has a polycystic kidney disease, then you know that there's a really concern about those cysts. You get more cysts and the cysts become bigger. And then those big cysts then squeeze out the good nephrons that are working. And so then that leads to progression of kidney disease. And so this guy at the University of California at Santa Barbara has this great website called the Wimes Lab website. And he is one of the people who is doing a lot of research on caloric restriction and polycystic kidney disease. And so he just talks about it that if you think about it, we have to eat. So you can't just not eat, but you can do what's called intermittent fasting. So intermittent fasting means that there is a time period during the day where you're not constantly snacking, but you allow your body to go into what's called fatty acid oxidation. So that means that when you're not eating and you haven't eaten for a while, then your body is going to utilize the fat deposits in the body to create energy stores for your muscle and for your brain and your heart, okay? And that's called fatty acid oxidation. And so then that leads to what's called ketosis. So ketosis means that you're using fat stores as your source of energy instead of what you've been eating over the past few hours, okay? So then what that does is then that leads to actually changes in the kidney. So this is actually a study of looking at cats with cysts in their kidney and showing that if you look on the left side, you can see that there's some really big cysts in the kidneys of these cats. And then this is just showing it when you look at the cats after they've had several weeks of this fasting, of this intermittent fasting, where they have like 23 hours where they don't eat, that the cysts actually shrink in size, which is really phenomenal. So it's not only that you're showing that it slows the development of new cysts, but it actually shrinks existing cysts. And then this is just showing you that if you look on the far left-hand side, this is showing you the percent of the cysts that are in the kidney, that with intermittent fasting in rat models, it decreases by about 13%. So that's really quite amazing that some kind of intervention would actually lead to regression of cysts. So the clinical implications is that fasting is actually one of the oldest forms of medical therapy. And so if you think about intermittent fasting for humans, generally it's going to be either you would fast every other day. I mean, obviously you still have to eat, so you're going to be fasting every other day, or you would fast like 16 hours a day and eat just during an 8-hour window. But of course, if you have diabetes, make sure that you talk with a dietitian and your physician about any types of changes in your diet, and especially your dietary patterns as fasting. But there is some evidence that fasting, intermittent fasting and caloric restriction would be beneficial for multiple forms of chronic kidney disease. Now, the other issue that you can do that would affect aging in the kidney, especially in the setting of diabetes, or if you have non-diabetic kidney disease with protein in your urine, is the use of what's called the SGLT2 inhibitors. So that's like Jardiance or empagliflozin, dapagliflozin, all these things that start with the flozin. But those actually mimic a fasting state, because you end up losing sugar in the urine. And so it actually reduces glucose levels without increasing insulin, which is similar to a fasting state. So one of the potential reasons that SGLT2 inhibitors, a new medication that actually can slow kidney disease progression, is that it mimics a fasting state. It's also that it can also have hemodynamic effects as well. But if you have diabetes and kidney disease, I would definitely talk to your doctor about the potential use of these SGLT2 inhibitors that mimic a fasting state to help you slow kidney disease progression. So if you just look at this, this is just looking at fasting versus the SGLT2 inhibitors. So the SGLT2 inhibitors, which block sugar reabsorption by the kidney, they do lead to a little bit of weight loss, just like fasting would. They do lead to increased use of fat to create calories. They do lead to endogenous glucose production by the body by the use of breaking down fats. They do have a little bit of a diuretic effect, just like fasting would. And the reason why fasting would cause a little bit of diuretic effect is when you fast, your insulin levels go down, and then that leads to a loss of salt and water. So a high insulin level actually makes you retain fluid and retain salt. So what you can do as far as the aging process is to try to maintain a normal body weight. So trying not to get overweight and gain weight with aging, which is very, very difficult, especially in the US. But try to not eat processed foods and soda, which are very dense in calories and make us put on pounds. And we know that eating fresh fruits and vegetables also is a way to ameliorate the aging process. And I would say, talk to a dietitian. If you have kidney disease and you've never talked to a dietitian, you're really missing out on an opportunity to improve your health. So Medicare and most insurance companies do provide 100% coverage to talk with a dietitian with no copay. And so get on the phone with a dietitian and talk to them. You can talk to them about all sorts of different things that you can do to slow the aging process of the kidney, changing your diet. And they can even talk to you about suggesting certain medications to your doctor. They can't prescribe, but they can certainly talk about those things as well. So the other thing would be exercise. So exercise is actually incredibly important for slowing the aging process of the kidney. And I'll tell you a story. I had a patient who, I still have him right now, who came to me with polycystic kidney disease, and his GFR was about 15 when I first met him. So he had been told by another nephrologist that he needed to start dialysis. And he actually has a background in exercise physiology. So he knows a lot about exercise. And he said, I really want to try to see if exercise can delay dialysis for me. So he started going to the gym and started measuring, how much time he was at the gym and his miles. And to make a long story short, he would exercise about 3 miles on a treadmill, either walking or running, whatever pace he could do. And he did that about 5 days a week. He stayed off dialysis for 3 years with a starting GFR of around 15. So there is a lot of research on the types of exercise that are best for the kidney. One of the best things you can do is get those bands, those exercise bands. And they don't have to be and have a really high resistance, but they're just like long, stretchy bands. And just working your muscles with those bands is really beneficial for your kidneys because you're exercising the muscles, and exercising the muscles actually stimulates genes to suppress the aging process. So when you exercise, you're kind of telling your body, I don't want to age so fast. So being sedentary and not doing a lot actually accelerates the aging process. So that's what I would recommend, is to definitely encourage someone that you know or yourself, if you have kidney disease, to go out, take a walk, get those bands and try to do those bands. And then also think about, the types of foods you eat, and talk with a dietitian about whether or not you can alter your diet. Well, that's what I really wanted to share with you today. I want to see if anyone has any questions about what they can do for their health. Sure.
Hi, I'm 56 years old, and I had a kidney transplant in 2015 from a cadaver kidney. And I wanted to know the aging process I was told he was in his early 20s. He was in a motorcycle accident. So is the aging process for that kidney in my body, will it be normal, or is it progress based on like medications and all the stuff that I'm doing, or will it stay the same?
Right. So let's talk about that. So the fact that you got a kidney from a young donor is really great, right? So that means that, because remember that that person, when they were at 20, they probably still have a pretty good nephron number. So they probably gave you about 800,000 nephrons probably, right? Because they were really young. So you have a number of nephrons in that donated kidney. And so that's the reason why in someone who is young and they get transplanted, we would rather give them a young kidney, because an older kidney is going to have some nephron loss, right? So once you get a kidney like, after the age of 60, they're probably going to have maybe like half of those nephrons or 2/3 of those nephrons. So number one is really, really good that you got a young kidney. Now that transplant kidney is going to age just like it would in the 20-year-old. And you have your immunosuppressant medications, which make that go a little bit faster. Yeah, so you do have like an acceleration of the aging process, especially because of the calcineurin inhibitors is a problem. But what can you do to help prevent that? Well, number one was definitely be compliant with your medications, because rejection is going to cause you to lose nephron numbers, right? And then you want to try to make sure that you follow a healthy diet and try not to gain a lot of weight with transplant, which is difficult, right? But looks like you're doing fine with that. And then exercise. So exercise does turn down the aging process. So, and I'm not saying you have to go out and get crazy and do Ironman or anything like that, right? It's just try to do something consistently every day, even if it's only 20 minutes. Yeah. Does that answer all your questions or, yeah?
Oh, nice presentation. I would have asked his question. So the follow-up to that is, so I am similarly transplanted in 2015. So coming up on my 6th annual transplant clinic, my GFR is 66. So I mean, for the first time I understood what, 66 would mean as far as GFR. So that seems normal. And I'm 61 years old.
Mm-hmm.
My donor was 50 when he gave transplant, when it was a living donor. So the question is 66, assume I live 20 more years. I have other conditions, all the immunosuppression and all that. How long can I expect this kidney to last? And I take good care of my diet and I'm not overweight.
Yeah, so just with aging alone, you're going to lose about 6 mils per minute per decade. So you can assume that, so if by the time you're 70, you'll be at 60. If you're at 66 now, with just healthy aging, you'll be at 60 by the time you're 70. You'll be at 54 by the time you're 80. Right? So it's about 6 to 10 mils per minute loss per decade. So if you were starting with a GFR of 20, and I know that you have 20 more years to live, then I would be concerned that in 20 years, we're going to be talking about having to do another kidney transplant. So the fact that you're at 66 in your 60s, that's not bad. That's pretty good. Yeah, but definitely, exercise, eat healthy, be compliant with your medications, just really take care of that kidney. Don't take any non-steroidals. And the other thing I always tell my patients is every time you see a new doctor, tell them you have kidney disease, because we constantly see non-nephrologists prescribing medications that we're like, oh, geez, I wish they hadn't prescribed that, right? So you just have to really take care of that kidney, which I'm sure you're doing. Anything else? Okay. All right. Yeah.
Doctor. My voice projects. Anyway, thank you, Dr. Kramer. And just wanted to let everyone know that with NKFI, we have a dietitian. In fact, she's in the next room doing a presentation free of charge that can speak with our patients. Give her a call. She is phenomenal. Dr. Melissa Prest. And so as Dr. Kramer indicated, if you haven't had a chance to speak with a dietitian, please call NKFI for that. So thank you. Oh, I did have a separate question, but I need to do that first. Anyway, I had a separate question. When you were going through the EGFR, and we've seen, and it's been in the press, information about the race-based EGFR. Would you mind speaking to that?
Yeah, sure.
For the group. Thank you.
Yeah, sure. I think someone behind you wants to ask a question too. Yeah, that's okay. But go ahead.
Some questions. ask you questions by
Sure,
email?
sure,
What
absolutely.
is your email? I'm sorry, I didn't
No,
see.
no, I'm happy to answer a question. Let me just say a few things about answer her questions and we'll go to you. Does that sound okay? Okay, I just do want to say I have referred patients to Melissa Prest, and we've actually used her for group education, and she's just phenomenal. I think she really gives great advice, and she's free, but you should be able to get medical nutrition therapy from your own dietitian at your own place too. But there may not be as good as Dr. Prest. There is a skill to medical nutrition therapy. Okay, so the race-based GFR is a very interesting story. Back in 2015, a group of medical students heard this presentation about glomerular filtration rate, and that there's separate reporting of if you're Black or African American, and then if you're not Black or African American, and they would give a separate GFR, and that the one for African American or Black was actually 20% higher. And the medical students said, "That's weird. Why are we doing that?" And they looked into it, and they said they actually lobbied for their medical center to stop doing that. They said, "This is just really racist." And so that particular medical center actually did stop doing that. And then the medical students started talking, medical students all across the country, and said, we really need to do something about this, race-based GFR, because race is really a social construct, right? I mean, it's not a biological construct. I mean, the color of your skin doesn't necessarily reflect the biology of a person. So then the National Kidney Foundation and the American Society of Nephrology then came together and said, all right, we'll look at this issue. And so for the past year, the task force that included people who have kidney disease and included like primary care providers, nephrologists, and lab people as well, decided, this is time to get rid of this race-based GFR. It doesn't really make sense that we have it. We can still give really high quality care without the race-based GFR issue. So now you're going to kind of gradually see that labs across the country are going to just have one GFR reporting instead of a separate one for African American or Black. So I hope that answers the question. But yeah. Yeah, University of Chicago, I'm pretty sure eliminated race GFR a while ago. Does it have a separate one there?
Yeah.
It does, really?
Yeah. It says
So, yeah,
non-African American and then African American.
Yeah, so Loyola, they still do that now, but we just got an email saying that they're going to be changing it. So the task force report came out in September of this year. So I probably have to give them a few months because the lab has to change how they calculate GFR. But that will go away. Yeah.
So just an addendum to that, it's positive on many fronts. And, as an African American, what happens, you would get your blood work back and you never had a GFR number. What would happen, it would go. So it says, so then your doctor would say, well, if it's no number, that's good. If that means you're in the normal range. And so you either would have to ask your primary care, provider for what's the number, because then what happens is you would just go into your EMR, and you would go and you would look at all your different results, and it would just say greater than 60, less than 60, and then it would just go nothing, like normal. And so you didn't get a number. So finally, I think with the work that has been done with NKF and with the National Kidney Foundation and the American Society of Nephrology, you can get a number. I don't have kidney disease. My grandmother did. She died from kidney disease when my mom was 14. So I'm just, very aware and conscious, and that's why this is a passion for me and not just a position. But the point being, it's really great that the work that's been done, because for the first time, I was like, oh, I have a number that you can see, because at least that was my my experience that it was not enough. You had to ask your doc, what is the number? So this is good that the labs and the science is, is going in that direction. So
Yeah.
thank you.
Yeah, and it's, and the National Kidney Foundation is still, it'll continue to change. It's not perfect now. And there's actually, your GFR, there's actually about a 30% error to it. So it's not precise. It's pretty good, but it's not, and hopefully we'll have markers that are much more precise in predicting the GFR. Okay, there was another question in the back. Oh, okay, sure. I'll give you my email. Sure, I'll give it to you. I can't type it in here. It's just my email is hkramer@lumc.edu. hkramer, HKRAMER @LUMC for Loyola University Medical Center.edu. And if you're going to email me, then I'm going to try to get you to be an advocate for kidney disease research. Now, to tell you this little story is that I've used my pull with the National Kidney Foundation to try to get them to lobby for more research for kidney disease. So in 2016, the Alzheimer's Disease Foundation, just like the National Kidney Foundation of Illinois, they lobbied Congress. They actually doubled their funding from about 600 million to like $1.5 billion for Alzheimer's disease research. And it's been utilized to develop several new drugs, to determine how nutrition affects, dementia. I mean, it's really, really been eye-opening and huge amount of research to help people with dementia. And so I went to the National Kidney Foundation. I said, we need to be doing the same thing. We really need more research in kidney disease. Dialysis and transplantation should not be the only options for people who have kidney failure. So they are doing that. But I can tell you that when we go to Congress and talk to senators, they don't like talking to people like me. They want to talk to people who've been directly affected by kidney disease. My voice doesn't really matter, but your voice does. And so we are looking for people who'd be willing to be on Zoom calls or sign petitions and just be a voice for kidney disease, because that's how the Alzheimer's Disease Foundation did their advocacy, is that the families and the people with kidney disease came together and advocated. It wasn't the neuroscientists that got the funding, it was the families and the patients. And so for kidney disease, we need the exact same thing.
Going to just echo that. And the being a kidney ambassador, being a KACC, with advocacy. So we have, as you know, I would say our moniker is prevention, education, and empowerment. That's a part of the empowerment. Each of us, everyone has a voice. And as Dr. Kramer stated, they want to hear from persons that have been directly impacted and affected. And one part I did want to bring up, I didn't want to introduce you, prior to the presentation, but, for the benefit of those that are in the presentation today, as well as the future recording. So Dr. Kramer is the immediate past president for the National Kidney Foundation on a national level. And so for those that may not have had an opportunity to know that, and so when you're stating about that your voice is relevant, but more relevant are the individuals and the families, impacted. We really, want to get you guys engaged that have not had an opportunity yet, because your voice really, really matters.
Yeah, it does. It does really, really matter. You can really not only help yourself, but you can give back. You really can give back. There's a huge need. So, okay, I think we're done. Thank you so much for this opportunity.
Thank you.